what side effects will patients expect when going into an IVF cycle? It's really important to us that patients are prepared, and pre-warning them of the sorts of things to expect makes their journey through that process slightly easier. You have to inject hormones to encourage the small resting follicles in the ovary to progress over the time of the stimulation of the ovaries, and that takes around 2 weeks. So injections is one part of the treatment. Those injections are tolerated really well by most patients, but there'll certainly be some patients that don't like needle injections, and we'll obviously support patients to understand the best way to do that, to try and minimise discomfort. When you actually stimulate the ovaries and the follicles mature, they'll actually enlarge within the ovary itself, and that can cause the symptom of bloating. In extremis, if patients produce a lot of eggs, there's a condition called ovarian hyperstimulation, which thankfully doesn't occur very often, and certainly here at the Evewell, we have a very, very low level of this occurrence. When patients come to an egg collection, they'll be put to sleep with a sedation, not a general anaesthetic, and eggs are collected vaginally using a needle which passes through the vaginal wall into the ovary, draining the follicular fluid from each follicle that's accumulated during the IVF treatment and stimulation. When you wake up from that procedure, most patients feel very well, and within an hour or two will be on their way home, but you'll certainly feel a bit of discomfort and lower abdominal cramping. And it's important to also understand that in the days after that, just the whole emotion of doing an IVF cycle and the fatigue of having been injecting and the build up to that egg collection day can sometimes be quite overwhelming. So it's important not to book too much in whilst you're doing your treatment and to be kind to yourself.